another busy day at the clinic. But today, I'm going to do something different, something scary. I'm going to rock the boat, or translate it from a Dutch phrase, I'm going to curse in a church called TEDx. I see a dilemma that doctors encountered with participatory healthcare. Let me first introduce myself. I'm a young doctor at the most innovative hospital of the Netherlands. I support the charter, And I support the charter, Compassion for Care. And previously, I worked as a tropical doctor in Africa for 3 years. I've seen and practiced medicine on a different condition, but although my work is my passion, and I'm proud to be a doctor, mostly I'm a partner, happily married, and have 4 wonderful children. So you might wonder, wow, can this young doctor have a dilemma while preaching patient empowerment as the ultimate goal? And I agree. I was impressed by the talk from Bas Bloem last year. He inspired doctors to step down from the throne and to become one of us. He concluded with his fortune cookie, participatory health for all of us. I think most of us try to be a coach, a guide. At least I try. And most of the times it works perfectly. But sometimes a dilemma appears.
Last year, I was admitted several times to the hospital. This was not my first encounter with medicine. I've been a patient since my teens. I've been in and out of hospitals. I've seen many doctors, and I've unwillingly, uninvitedly, I've found my way how to deal with healthcare.
And I was your doctor during one of these admissions, and I wanted to discharge you. Your situation is stable, and I really think it's safe to go home, because home is the best place to be.
But I was worried. And I was discharged before, and I was admitted before. I've seen more doctors. I don't feel safe at home. I don't feel comfortable at home.
Okay, I think I understand your situation. But as your doctor, looking at your file, looking through your life, I really think and truly think that home is the best place to be. Mostly and primarily because it's in your best interest. But also, we are not a hotel.
I'm sorry. Then we have a problem, and I request you to have another doctor.
Yes, I think we have a dilemma, and I requested you to have another doctor. Now, waar komt-ie? You might have wondered what happened between these people. And I'm going to take off my coat, because the fact is that Jeroen was my doctor. And I was his patient during the hospital time. And I knew the battle of the hospital, but this was not my own battle anymore, because I was fighting for someone else. I was fighting for my unborn child.
Dankjewel. Do you mind if I take the floor?
Please.
Have a seat.
Thank you.
Ladies and gentlemen, participatory healthcare. It's a wonderful term, and it's also a difficult term for a Dutchman. Yeah.
And a Dutch woman.
It's a challenge, and I think it works in 80% of cases. But in 20%, a dilemma appears. And those cases, they take up a lot of time and emotion. They affect you as a doctor, but also as a person. And I want to share 3 of those dilemmas with you, concerning time, concerning emotion, and concerning clinical practice. Let me start by time. Oh, yay. Of course, we strive for continuity of care. Very important. And of course, I want my doctor to be available as much as I want to be available as a doctor for my patients. That's the charter, compassion for care. Treat the others as you want to be treated yourself. But as a doctor, I have other patients. I have other duties, management. It's an academic hospital, education, research. I cannot be available all the time. Managing time is a challenge and sometimes a dilemma. Concerning emotion, of course, I want to be the empathic doctor. I want to sit next to my patient and talk to her. I want to remove the white coat and remove barriers. But a colleague of mine told me once, and she's working with oncology patients, she says, I cannot be empathic all the time. I see so much misery and so much discomfort. I cannot let the patient come too close, otherwise I cannot function. I need the white coat as a barrier to protect myself. Balancing emotion is a challenge and sometimes a dilemma. Now the third, clinical practice. Of course, I want to be that guide. Bas Bloem mentioned last year. I want to be the guide. I want to help the patient with informed decision-making to find the optimal solution for their specific problem. Wonderful. But what is optimal? Who decides? Who pays? And sometimes I see patients coming with requests that are driven by fear or anticipated regret. And I see doctors that go along with these requests. Same for me. Fear, doubt about evidence, and anticipated regret. Or even fear about prosecution. Legal, medical, but even public on Twitter. How do I react? How do I act when a request from a patient collides with medical evidence? When it collides with a national vision on healthcare, with local protocols, or even closer, when it collides with my personal vision on good quality of care, my personal oath as a doctor. Where do we draw the line? Where do I draw the line? Balancing the line is a challenge and sometimes a dilemma. And time is also a dilemma. There's doubt. Am I the only doctor who's facing these issues? Am I a bad doctor? Conservative? Negative, withholding innovation? Or am I a pioneer who is opening issues so others might follow? I hope I'm the latter, so more doctors will be able to show their dilemmas. When we as doctors, we face these challenges on a daily basis, and different doctors do so differently with different circumstances. And that's difficult, both for the patient who sees many doctors, but also for the doctor who has to treat different patients. I think we doctors need to be aware of our borders. And I'm crossing it a little bit, sorry for this. We need to be aware of our lines, and we need to be able to show them. Patients need to be empowered. It's a good thing. But doctors also need to be empowered. We need to be empowered in becoming a guide while remaining an individual person, an individual doctor. I think this deserves attention in medical school. In closing, ladies and gentlemen, participatory healthcare. I think we, both patients and doctors, we need to be aware of the challenges we face with participatory healthcare. We don't have the answer, except for being aware that these challenges exist and being able to share them with each other, like we did. Although honestly, we only did it for this TED Talk, I think. But by doing so in an open and respectful way, I think eventually we can make healthcare truly participatory. Thank you.
Thank you.
Thank you. Come.